it should not be painful.
Yes.
Oh my God, that was the worst. No. That was a bad experience. That was not my
It was the worst?
At the time, it was my worst experience. I was for sure that I don't have the capability of getting pregnant. Also, overthinking. I told you, overthinking. And also, I'm a hypochondriac. So,
Girl, see.
again, I don't share food. You must know I don't share food. I don't share food. I don't share anything. I don't like sharing. Mostly because, what even that? If you've been on any iron supplements, can you imagine? Just take like a piece of chuma, put it in your mouth, and have it in your mouth throughout.
The ghetto.
Literally metal.
What you're saying is the
metal
ghetto.
in your mouth.
Hey, that's interesting.
By the way, I have noticed when I go to the toilet, I'm seeing something pink. I'm noticing a pink discharge. In the morning, at like 9 a.m. in the morning, she called me. She's like, you saw pink and you didn't see that you should call?
Hi guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough health information to make you make an informed decision. My name is Dr. Hope, and I have a lovely guest today. And we are still on yapas, by the way. It's a bit we are stopped. But I'll give her the chance to introduce herself the way she wants.
That's true. Thank you so much. Thank you for having me. My name is Lynn, Dr. Lynn. I prefer Lynn. Others call me Wamboi, whichever it is.
AKA?
AKA.
Thank you.
No,
AKA.
I'm even forgetting because I'm like, Jesus Christ. Mind Fence MD.
Yeah.
That's on Instagram. I'm on TikTok, yes, but I'm really not active on TikTok. Let's be honest. Let's be serious. Not serious, but let's be honest. I'm not very active on TikTok. But on Instagram, I have not been active.
Yeah, you left us
for quite some time because you know,
life happened.
Mambo ni mengi. Yeah.
Okay.
And I'm happy to be here.
Thank you.
Yes.
Wacha tu niseme you've been missed, by the way.
Nimewamiss.
You know, I had started enjoying your vlogs. Remember your vlogs?
Actually true. Yes.
Whether you are doing too much.
Kuna mtu alinitext not text, alinidm akaniuliza sincerely. You're really not going to come back to YouTube.
For real.
And I told them, my friends, mambo ni mengi. Mambo ni mengi kulea kuzaa.
You had it here. But karibu sana.
Thank you so much.
Come and talk.
Yes.
Yap. Unleash. Release.
Certified yap.
And we are really happy to have you here.
Thank you.
So to start off, I normally do a journey to Inside Out.
Okay.
Have you watched Inside Out, the movie?
Wait, the cartoon with the emotions. Oh my God, yes. And I cry so much.
Yeah. I'm so happy. She was telling me she hasn't watched it. And I was just like,
nakumbuka.
Sasa tunaongeza how many people to
mambo ya
this list.
maternity. Please, uniangalia hapa kwa macho. Mambo ya maternity ni mengi sana. I cannot remember, but yes.
Yeah.
Yes, but not watched the second one.
It's okay.
Yeah.
The first one, at least it gives you the basis of, you know what it's about.
Yeah.
So how are you emotionally today?
Today I am happy.
Oh, love it.
Today I am happy. I was a bit sad earlier on in the morning, to be very honest with you, mostly because my baby is teething. I think we are teething.
How many months are we at, first of all?
We are almost 8 months. We'll be 8 months, I think, when is today?
Wow.
In 10 days, in about 10 days.
Wait, when is today?
Today's 7th.
Yeah, today's 8th.
Today's 8th?
Yeah, today's 8th.
Oh my God, no, so in 9 days. So we'll be 8 months and days. So last night sleeping was a problem. He cried so much. So that already was like, oh my God, are you okay? Then I felt he was a bit feverish. Teething does not cause fevers. Back. So the thing is, I was like, are you sick? What is happening? Of course, we have to evaluate. It was just a mild fever, to be honest. And they do say that temperature in Zapanda kidogo.
Yeah.
But he did feel feverish and he was so fussy. Then today morning, same thing. So crying. So nimemshikilia tu hapa until he woke up and just smiled. Like when he actually woke up kabisa, he just smiled.
You're just like, whoo.
I was like, oh my God.
Thank God.
But bado, I'm just like, I'm not happy. I wasn't happy at that time. But as I was getting ready, I saw him playing, laughing. I was like, my mood itakuja ako sawa. So now, at this very moment, I am happy.
Oh, I love it. I love it. You remember when we spoke, because we spoke like months ago planning for this.
Yes.
And you asked if you can bring the baby.
Yes. Oh my God.
Yeah, me, I was waiting.
So anxious.
I was waiting to see the baby.
I was so anxious. There's no way I would have left my baby at that time. That baby was attached to my hip. Yani kabisa.
Were you still on maternity leave?
At the time, yes.
Yeah. Okay.
Yes,
okay.
yes.
Okay.
Yes, I was. But I was very I was very anxious to kumwacha hata kidogo. Yeah, it was not a good time at that time. Yeah.
And we'll talk about this because I
Yeah,
mean
we'll talk
the
about
topic
that. Yeah,
is,
'cause,
is
in
motherhood.
hindsight, it's just not a good time. Yeah.
Let me see. For me, I'm happy. I'm excited.
Yeah.
We haven't filmed in a while.
Yeah.
Just because we bulk film
Yeah.
and we had like enough for some time.
Yeah.
And then also kuwapanga. Hey,
Mambo ni mengi.
kuwapanga is not easy, my friend. You're available today. You're not today.
available,
But we thank God it's finally happened.
it's
So I'm
true.
excited. I'm
Yeah.
happy. And it's really, really
Yeah.
refreshing to see you. I think the last time I saw you was
Yes.
last year.
No, it
Unakumbuka?
was the year before that. No, I went back to my texts.
Oh my gosh.
When we went for pasta in the Giri. Yeah. That was the last time. It was the year before that because last year
Damn.
I was pregnant last year. I
Yeah.
really wasn't outside like that.
Okay, for real.
Yeah.
Okay, fine.
So
Let's
it
not get
was
ahead of ourselves. We'll talk about that. Is there any medical jargon you want to debunk?
Is there? Maybe throw something at me.
I think also because you've talked about teething,
Yeah.
maybe you can explain how the fever comes about.
Okay, so the thing is,
Yeah.
what happens, at least this is what I got from a dentist who actually corrected me.
Yeah.
That was 6 years ago, give or take, when they came and told me teething does not cause fevers. What happens, there could be an inflammatory, because it's an inflammatory response.
Yes. Yeah.
You can get hotness of body, but the temperatures don't go as high as 38. They'll go high by like a 0.2, 0.1, 0.2 degrees. So
Yeah.
that's 7.6, that's 7.7, thereabout. But by the time you're getting like high grade fevers, there's something. Teething doesn't cause diarrhea as well. Today I was telling my nanny that it does not cause diarrhea.
Oh, for sure.
What happens is mtoto atachukua whatever is dirty, or I mean they'll touch everything. They're mouthing, they're gumming, they're trying to put things in their mouth there to soothe their gums because it's painful to teeth. So with that and things are contaminated, you do expect
some infections.
And probably that infection is what is causing the high grade fever.
Exactly.
Exactly. I mean, there are some kids who may have high fevers and you try and do investigations and whatever, and after the teething happens, fevers go down, but we can't really explain it. But for majority of the cases, teething does not cause fevers. It's a misconception.
Okay.
Yeah.
You've reminded me of something I saw the other day.
Yeah.
You know the way now reels, there's a lot of misinformation everywhere.
Yeah.
So there was a babe on the internet who was trying to explain what idiopathic means. So she went to the doctor and she was told, oh, your condition is idiopathic. And she was trying to misconstrue what it means. So I was just like, let me explain, because what you've said is sometimes it's inflammation or like the fever can't really be explained. There's something called fever of unknown origin. But also sometimes there are idiopathic conditions as we really can't explain why that is happening.
There's
no explanation. Yes. So we'll still investigate, and many times we do a diagnosis of exclusion, but we really can't explain what is happening. So that is idiopathic. But we'll put like the proper definition hapa chini. Ile ya not Wikipedia, ile ya Medscape.
Yo, I'm up to date. I'm whatever guidelines.
WHO, Cleveland, Mayo Clinic, NHS, hizo. Sawa. So why do we have you here today, girl?
We are here. Sikia, unavyoangalia kamera like, let's look at each other.
Look at your camera.
We are here to discuss motherhood. We are to discuss motherhood, right? Yes, we are here to discuss motherhood. All things motherhood.
Yeah.
Prenatal, antenatal, intrapartum. I'm using medical jargon. I've just realized.
It's okay. We'll break it down.
Postpartum. So it's a whole thing before you get pregnant.
Yes.
When you're pregnant. Inside the delivery situation.
I thought you were going to say inside the pregnancy.
No. No, inside the hapo. Mambo ya kuzaa.
When it's moto.
And then postpartum, which is even more fire. Fourth trimester. Let me shit.
Okay. We'll get there, Trafikia. Okay, sawa. Actually, for really, but explain it perfectly. So many a times I know when you're talking about pregnancy, postpartum, labor and delivery, we forget the preconception. And I remember having a conversation with Dr. Kenya, and she said, sometimes we talk about pregnancy or getting pregnant like it's something so simple.
It's not.
And I was like, the motherhood journey or the journey to motherhood doesn't start at pregnancy.
It actually doesn't.
It starts from, for many women, when you're thinking about conception. So I want to get pregnant. Let me start, the steps to getting pregnant. For those of you who it's an oops, it happened, you're lucky.
Yeah.
Because I mean, you tried it maybe once, twice, a few times, and you got pregnant. But there are actually women who really struggle to get pregnant, and they take so many steps to actually conceive.
To get to where,
So how was it for you?
For me,
Ulikuwa umepangia ama?
to check. Honestly, yes.
Okay.
There was no way I was going to have a baby if I felt I was not ready to have a baby. So when I was ready to have a baby, I did talk to my spouse. I told him, even in Nataka, I want a baby. And I want a baby. At the time, I was on contraception. I have talked about this on my page. I was on Mirena ghetto. First of all, I loved it. But the insertion, oh my God, ghetto.
First of all, we are revisiting that because guidelines have changed.
Yes, I saw something like that. Yeah, that pain.
It should not be painful.
It should not be painful. Yes. Oh my God, that was the worst. No. That was a bad experience. That was not my worst.
It was the worst?
At the time, it was my worst experience.
Yeah.
But so when we decided to finally, yes, we can have a baby. Yes, we can have a baby. I did go to a gynecologist because I do have this mode of contraception.
Yeah.
I need to figure out what do we need. So first things first, I need to mention that I do have mental health spiciness.
I love it.
Spiciness. Okay.
A bit here, a bit
so
there.
A bit there,
Yeah.
Here and there. So the first thing she did was like, by the way, I'm not going to remove this coil until you have a letter from your psychiatrist to tell me what we'll do about your medication, what we will do after, during your pregnancy, because you can't get mood changes in your pregnancy, and at the same time, what we'll do in postpartum, because you are very likely to get postpartum depression.
Yeah.
And I was like, okay, sawa, I can see you're being keen. Sawa. Went, got a letter from my psychiatrist, because the medication I was taking, would not have been safe for a pregnancy. So that was changed. I got a letter in about a week or two. Got a letter.
Went back. Was like,
Cindy. So it was like, he was like, you want a baby? It's fine. We will plan for this. We will change your medication like this. Ended up writing a whole letter. Had to take it back to my gynecologist. So after that, that's when we had a very long discussion. I was with my husband at the time. So we had a discussion on all these things, and then finally, I think I had 2 appointments, one with my husband, another with my sister. So finally had all these conversations, had the coil taken out. And then she sat me down and told me, let's be real, okay?
Yeah.
You're not very young, okay? You're not very young.
Ooh, okay.
And therefore, do not feel bad if you don't conceive immediately. Because, of course, as you get older, conceiving becomes a bit
more
harder.
difficult, yeah.
So she was like, don't feel bad. It's okay. If in 6 months, typically people are given a year.
Yeah.
But for me, I'll come in, if in 6 months you have not conceived, we can have a discussion on this.
I love that.
Yeah.
I love that.
Yeah.
And I think because I want this, so it's going to be a series. So we'll have different specialists who are also mothers, just to come and share a bit of what I think mothers and people who are looking to get into the motherhood journey can learn.
Yeah.
And we normally talk about mental health mostly during the postpartum phase, but I think it should start from the beginning, because that preparation, trying to conceive on its own, can drive you insane.
Yes.
Yeah.
Yes.
Continue.
Yes.
Nasikia kuna story hapa.
I'm like, okay, sawa. It's one thing for someone to tell you, for a doctor to tell you, but they manage your expectations.
Yeah.
But in my head, I'm like, sis, I need to get pregnant. It is getting pregnant today.
Yeah. And you're like, Connie, you don't know my body?
Yeah, Connie, you don't know. At the same time, I was really worried because I had not had my period for the period I had that coil. I had not had a period, I think, save for once. It came for like a day. So I had no clue about my cycle, any cervical mucus changes, nothing, like zero.
It's like a new body.
Yeah, it's like a new body. So I'm like, okay, I have to manage my expectations, but at the same time, I am so worried that I might actually not get a baby. So I did what I do best. I overthink. Okay.
Welcome to the club.
I overthink. I remember sending my sister a reel telling her, oh my God, I probably have very high prolactin levels. I have hormonal issues. I should check my testosterone levels, my estrogen levels, my all these levels. Could be there's an issue. Because I think 3 weeks after getting the coil removed, you see, I was told to manage my expectations.
3 weeks.
3
Madam,
weeks, my
3
dear.
weeks.
3 weeks.
I'm sorry to laugh.
Please check her, because okay, at that time, when I think about it, I was so desperate. I was so desperate. I can't explain what it was, but it was, my mind is made up. I want a child and I want a child now. 3 weeks, I'm like, nothing seems to be happening. Like, I don't feel anything. 4 weeks after that coil was removed, I remember feeling very tired. And then we were at work with one of the doctors who works there. She's called Dr. Njeri. She's an adolescent medicine specialist.
Oh, wow.
So we were with her and took in the canteen, the hospital canteen.
Yeah.
And the smell in that canteen, I just remember saying, oh my God, this place stinks. Ew, we need to go. She's like, actually, I will show you the reel I put that day. There's actually a reel we made on that day.
For aversions.
Yes. Like, not for aversions, like on that day that I felt that.
Yeah.
I have a reel on that particular day. And she told me, Lynn, you're pregnant. Lynn, you're pregnant. I'm like, pregnant? I'm not pregnant. It's been 4 weeks. It doesn't help that I think, delusions. I had already taken one test and it was negative. So I told her, I know where I'm pregnant. This is not, no.
Yeah.
Waited for like another 3, 4, 5 days, because she told me, just go and have an ultrasound done. Just go and have an ultrasound done.
When had you taken the test?
Like at 3 weeks.
Okay.
3 weeks.
Okay.
At 4 weeks. So that's the smell that's disturbing me. I'm like, what the hell is this smell? So she convinced, finally we talked and she convinced me, like, go and do an ultrasound. Went and did an ultrasound. Nothing, as in nothing. Nothing was being seen. Of course, just that I have a small fibroid. But other than that, there was nothing else. Aki hope machozi. Aki, when I tell you, I cried.
Oh no.
I cried so much. And I told my sister, Nivo hapa. Aki, for sure, I actually cannot conceive. I mention my sister a lot because my sister is a doctor as well. She's a radiologist. So at the time, she's, from a medical point of view, that's why I kept, of course, talking to her and telling her this is actually not working.
Yeah.
Clearly, there's nothing happening. So she tells me, you come, I scan you. Just come.
I was going to ask you, did she do yours?
Wait, come, I scan you. So we go, me, my husband, and now her. She scans. She says she saw, when we talk about it now, she told me, I do look, what was the word? I had what seemed to be endometrial thickening. So with that, it could mean either my period is about to come or there's just something happening. I can't remember vizuri what was happening, what I read at the time, but I remember those words.
There were changes.
Aki, if that is the wrong thing, Ivy, I am sorry. I actually don't remember what you said, bruv. I don't remember. So So we said, okay, fine. We just wait and see. 2 weeks go by. This time, by this, I'm done with this story. By the I've stopped thinking about it. I'm like, it's okay. In addition to that, by the before I continue, I had started taking prenatal supplements, and also made my husband take. Yes, because we need healthy sperm, guys. Please.
It's true. It's true.
Healthy sperm.
But that's just funny. Like, for real, we're in this together.
But then you're going to take these pills. I don't care. You're actually going to take these pills.
I think studies need to just come out so that we can see, does that work?
Does it even work? I don't know. For me, it was... So see, whatever, really, I need healthy sperm and I need to be okay with myself.
Yeah.
Ended up taking... I was on Pregnacare initially, then changed to another called Fertilex. It's at Good Life. Why? Because I was after Aki now, Puleni, medical jargon, myoinositol. That is what I was really after.
Okay.
Okay, to stimulate ovulation.
I was about to
No,
ask
see-
you, are you thinking now you're infertile, my sister?
Yes. So I'm telling my sister we need to do hormonal profiles because I am
Yeah.
for sure that I don't have the capability of getting pregnant. Also, overthinking. I told you, overthinking. And also, I'm a hypochondriac. So,
Girl, see.
yani, worst case scenario
Yeah.
also is also another thing. So, hypochondriac.
Apple.
Worst case scenario.
Yes.
Yani, everything.
Yeah.
2 weeks after that, should be 2-3 weeks actually.
Mm-hmm.
I remember it was a Saturday. We went for. I was feeling so tired, first of all, from work, like
Yeah.
extremely physically tired. So I was like, this is burnout. I have been here before and I can tell burnout is coming.
Yeah.
So I am feeling burnt out. Hiya.
So she thought.
So I thought, decided to go for ice cream. I think it was either Saturday evening or Sunday evening. Decided to go for ice cream with my husband, Hapa, at Coldstone. Do you know, I don't share food. You must know I don't share food. I don't share food. I don't share anything. I don't like sharing. Mostly because like if I need to share, let me just gawia you.
Okay.
Like use your own spoon,
Cutlery.
your own thing. Like no. Also, wacha nishibe kwanza. Like my God, why are you so after my food?
But say I need to taste it when it's hot.
Go after your food first.
Because
Go after mine.
Okay.
Very. So what happened? I ended up giving him my ice cream. I remember taking like a few bites and I was like, just have it, I'm done. That shocked him. He was like, eh?
Something is off here.
For real?
Yeah.
Nikasema, maybe ni the taste. Mi sijui ni nini nasikia. Oh my God, nimeskip mahali. Even before that, we had gone out the previous week. So we're at the club. We've asked for, this is a place we have gone to quite a number of times before.
Yeah.
So I asked for a Long Island. We've been taking Long Island's place. So that's from Long Island.
Wow.
I took a sip and I was like, take it back. Take this thing back because this is not what you normally make. In fact, hapa mnanidanganya. Take it back. Ikaenda ikatengenezwa tena ikaletwa. Yeye anasipa anasema iko sawa, it's the same. Mimi I'm sipping and no. Eventually ended up saying, just give it to him, nilete to Del Monte. Because ni kama leo amtaki kujua kutengeneza cocktails. I was so angry. I was so upset.
Can you imagine the bartender? Is there like, hi?
What is happening? Like, what is wrong with this one? So then now the following weekend with the ice cream. Then after ice cream, I told him, I'm going to chop it. Let's go to chop it and let me try some chicken hapo. 5 spoons was all I could manage. 5 mouthfuls is all I could manage. And I remember the last one, I took a serviette and just spit it out.
The way chop it is tamu.
Imagine.
Wow.
And I was like, I'm done. And I gave it to him. And I went home and I told him, but I think I'm getting sick. I am legit getting sick. I have shared my food with you.
I don't want the Long Island.
I am actually getting sick. I remember texting my sisters and telling them, you guys, I think I'm getting sick. Doctor clocked it. She's like, have you taken a pregnancy test? I'm like, please stop. Let's stop this story of pregnancy by there because it's already stressing me out. I don't want to nini. So she kept probing. You need to test. I think I got a break from work for like a week. And I was sleeping throughout. When I tell you, from morning to evening, sleeping.
Where?
I'm making up to pee, and that's it. That was what it was. I remember what ended up happening was, so this is like on a Monday, Tuesday, Wednesday, Thursday ficas. First I noticed those brown discharge on my underwear. So I was like, period. Kumbe this was the period. Then number
You're
2,
PMSing.
I was like, I was PMSing.
Okay.
Then I'm like, but my breasts are also tender. That has never happened to me.
Hey,
so I was like, Aki, imagine I had never experienced that. So I was like, so ninaanza kupata new things now that I have removed this coil. Wow, this is what people have been saying with PMS. Ghetto.
It is for sure.
Yeah, so I was like, okay. So finally, so breast tenderness, the brown discharge. I'm like, period is coming soon. It did not come. Ended up, I think the next morning when I went to the toilet, when I retched, so not vomiting.
Yeah.
I retched. I must tell you, I am an avid Reddit consumer. Like, I consume Reddit content
Kama unalipwa.
like crazy. So of course I'd been on these platforms on women and how they found out they were pregnant. And one woman had mentioned that she retched. And it was enough for her to know. Because that has never happened to me. Like, nimeenda choo, na aki, it was so bad. In fact, when I think about it, I'm like, I feel like, no. It was
like, what was the reason?
Yeah. And also when brushing my teeth, that happened again. And then my sister kept pushing, have you taken the pregnancy test? No. Have you taken
really
the pregnancy
in denial,
test? No.
like for real.
Finally, she's like, don't you have it in the house? I'm going to come and actually make you do it. I'm like, fine, I'll take it. I remember going to my closet, nikaenda nikachukua that one test that I had, because I had one remaining. Nikaenda tu nikakojoa na nikaeka tu hapo. Hata seconds did not pass. 2 lines. I threw it.
But you wanted it.
I threw it. I said, what? I had to go. I was so shocked.
Yeah.
I called her immediately, telling her, imagine naona lines mbili nimeenda kuchukua.
She's like, daktari. A whole doctor.
Nimeenda kuchukua ingine kuconfirm. And I went and I took, I think, 2 or 3. And then after I'd taken and fully, like, truly confirmed, I called my husband and told him, by the way, me, it was not even a surprise. You know how people are like, oh my God, surprise. No, I was too shocked to be like, I'm a surprise. No. So that's, So I told him, and I told my family. Yeah. The same day.
And I feel like that's a short time, relatively.
Yeah, it was very short and very,
so it was less than 6 months, right?
Yeah, it's happened, like, I removed my coil in March. By May 2nd week, I was already at 7 weeks. Yeah,
that is so interesting.
That's so fast. Yeah, because it was so fast. And that's the thing, I never got my period back. I never did.
So until now, you're not but
say nimerudi.
But do you know your cycle like properly now?
Yeah, it is back to exactly how it used to be. Exactly,
like back like I never left.
Yeah.
And that's interesting because, like, for you, it was nice. Like, okay, not nice. Like, you were still in a confused state.
Yeah.
But it happened pretty
so
soon.
Fast, yeah.
And especially the fact that you want family planning. Because for some people, it can take 6 months, 1 year. And even for, like, which is it? Depot, it can take longer. Yeah. So it's interesting that for you it happened that quick. So I think the message is just that getting pregnant is not easy.
Yeah.
For some it comes easy, but for many
for
women,
most people it
actually is a challenge. And I like the fact that you were also on prenatal. You spoke to your doctor about, the mental journey that it would be when it comes to conception. And you were in denial for a long time. Because you were in denial.
Yes.
Let's just stick out the symptoms of early pregnancy that you had. Because you had like almost all of them.
Yeah.
So you had the aversions.
Yeah, I had very, very bad aversions. Aversions to the point I lost weight.
Ooh.
Yeah, like food aversions. I could not eat for the life of me. Yeah, I couldn't.
Wow.
I actually couldn't. So I lost, I think, 3 kilos. Yeah. I could, so I'm not vomiting.
Yeah.
I'm nauseous, but not too bad.
But
I don't want food. And it's not at a specific food, it's all. It's everything. I can't stand everything. That's changed. I'm going to talk about it.
Later
that
on.
Changed. But I had food aversions. The other thing I had was fatigue.
About fatigue.
Very early on, my mood did change. I did get depressed.
Okay.
And I had to be reviewed, of course, by my psychiatrist. I was given another 2 weweeks off from work because I was crying. I actually burst out crying at work. Yani, full on sobs of yani, crying. Yeah, because I can't explain that hormonal shift. Dr. Vundi does a very good job with that, but it was such a horrible time. At that time, I'm happy, but at the same time, I can't explain. The mood was so low, so low.
And even your hormones are still trying to readjust because, of course, the Mirena you had as well.
Yeah.
Okay.
The other thing I had was there's a bone, you have your pelvic bone.
Mm-hmm.
Hapo katikati, there's something we call the pubic symphysis. That place, apo, pain throughout. Pain like no other. Like I can't explain.
I just keep
that.
adding to my
Please
my
add your
list
list.
of
The girl with the list.
you know the girl with the list of why not to get pregnant. What?
Yes. Pubic symphysis dysfunction. Like, it's called pubic symphysis dysfunction, something like that.
Mm-hmm.
And then I also kept having shooting pain from my bum.
Mm-hmm.
So it would be so bad. It shoots from my bum to the leg. I have to. I can't even walk.
Yeah.
So I have to stand, sit, and just wait.
Would you explain to a sciatica or it was different?
I would explain it as sciatica.
Okay. Sawa.
So
did you have frequent urination?
oh yeah, that was something else. Oh
You
my God,
did.
how did you forget that? You need to mention them so that I remember.
Frequent urination.
Yes, I had that.
Then you had
that
the
was
discharge.
horrible.
Some ladies have discharge.
Not so much for me, to be honest. In fact, I remember thinking, is this normal?
Mm-hmm.
Yeah, it wasn't too bad for me.
It wasn't too bad.
The urination
was more.
Yes, was a lot.
Okay.
Yeah.
Okay. What are the symptoms of early pregnancy? Let's
Vomiting.
see. The vomiting.
I think I vomited once.
Mm-hmm.
I was nauseous, vomited. That was
nausea.
Once. Nausea, yes.
Mm-hmm.
Is there anything else?
Let me see.
Of course,
I had a
breast
list
tenderness.
Here. Oh yes, you've talked about breast tenderness.
Now it's breast pain, like legit full-on pain. What else do you have on your list?
The mood. Did you have any cravings?
No.
You just had aversions.
Food aversions, complete aversions. Cravings came later. I will explain that because.
Were you thirsty? Were you thirsty and were you more hungry?
Maybe thirsty.
Yeah.
And specifically cold, ice cold water. That's the only thing I could take.
That's so interesting.
So
well, anyway, so the early signs of pregnancy, because you must learn, So we have the morning sickness, which is what people normally describe mostly having the nausea and the vomiting.
Yeah.
We have frequent urination, feeling tired, and that fatigue that people explain. Honestly, I don't understand it, because how can you be tired the whole day?
I swear to God, it's a fatigue like no other.
Where? Then emotional changes.
Yeah.
Then of course missing your period. Some people have skin changes, so you might have acne. And just discoloration, not discoloration, let me call it hyperpigmentation.
Yeah, that happened to me a bit.
It did.
But much
later
I'd say later on.
Okay.
Yeah.
Then, of course, food cravings for some or aversions for others. Then your appetite may change. You might become more thirsty. Some people have a strange metallic taste in their mouth.
Thank you. Oh my God.
What is that?
Because everything is going to taste kama chuma.
Are you
my God, that was
serious?
horrible. That
What?
was such a ghetto time. Oh my God, yes. That
it's feeling like when you take deworming, albendazole,
Yes.
that car.
What even that?
Secnidazole.
What even that? If you've been on any iron supplements, can you imagine?
Never.
Just take like a piece of chuma, put it in your mouth, and have it in your mouth throughout.
The ghetto.
Literally metal.
What you're saying is the
metal
ghetto.
in your mouth.
Hey, that's interesting. Then the last one, of course, breast pain, tenderness, or soreness. Okay.
Yeah.
So basically, when were you were just in denial?
But
we are happy it happened rather sooner than later.
Yeah.
So now let's move into now the clinic phase. When did you start going for your clinic? And how was your experience going for your clinics?
Please do not do what I did. Okay? Please do not do what I did.
What did you do?
It is good to own up to your mistakes. And I do. At 7 weeks, my sister ended up doing an ultrasound on me. So she did the very first ultrasound on me. Confirmed viability of the pregnancy. Fine. At 8 weeks, it should be 8 or 9 weeks, I went to clinic. Just to, of course, to say, I have conceived, we did this, it's viable. My gynecologist wanted me to do my ANC profile at 12 weeks. Not a problem, we ended up doing it at 12 weeks. Plus, there's something we call an NT. You know what, I'll remember that. I don't know, but it's to assess Down syndrome and to assess.
Okay.
So I did that at 12 weeks. So 8 weeks, 12 weeks. After that.
Don't say Uliruka. My sister. Or should I call you
As
Daktari?
I said, do not do what I did, because, you know, being a medical doctor is a good thing, but also not a good thing, because in my head I'd be like, but nothing is wrong.
Yeah.
But nothing is wrong.
Yeah.
I'll go at 20 weeks. I literally went.
But it's fine.
It's
Like,
fine.
in total, how many
I mean,
did you
it's
have?
fine. I think I went with the gynecologist I initially had, because I had to change to Dr. Kenya
Okay.
out of insurance issues.
Okay.
But with my first gynecologist, I say I saw her, like, to be very honest with you, twice.
Okay.
And it changed to Dr. Kenya at like 30 weeks.
WHO is looking at you like our ambassador. Eh?
As I said, do
Our
not
ambassador.
do the things I did, because let me tell you, like, after when I needed something, of course, you know, we're medics, I'll call and be like,
yeah. And you assume that's a consultation.
20 weeks scan. I went, did it, had it reviewed. So it was at 8 weeks actually, and at 20 weeks. 12 weeks when I went, it was more of, I did the ANC profile. I just never went back for a review. My tests were normal, so I was like,
What are the tests in the ANC profile?
so there's a medical check-on. It's okay.
Yeah.
So there's a full hemogram.
What is it checking
There
for?
was total blood count. If you, sorry,
No,
as in,
the main thing.
Hemogram. That's what we. I mean, yeah, your here HB is what we need to know.
Yes.
Of course, those are other things.
Yeah, but
Whether you have
mainly
mainly HB,
yeah.
And then we had to have a urinalysis. Of course, you need to check for infections.
Yes.
Mostly at that time, mostly infections. Then there was HIV, of course.
Yes.
Then there's hepatitis B.
Yes.
Then there's syphilis.
Yes.
Then there was there something else? I can't remember.
Did you do thyroid?
No.
Okay. Some people do thyroid, some don't.
No, for me, it was actually those. And now, sugars is another thing people do, but I didn't do at that time. I'll explain, because we ended up doing an OGTT
later
at 28 weeks, which is more accurate than this would be.
OGTT, oral glucose tolerance test,
to check for diabetes in pregnancy.
Yeah.
So those are the 5 things I remember doing, plus now the NT screening. So to check for Down syndrome, the different chromosomal abnormalities.
Yeah.
So that was my ANC profile.
Okay.
So because everything was normal, Daktari here said, iko normal.
Yeah.
Nitaenda tu at 20 weeks.
I mean.
Yeah. And still at 20 weeks, they do my scan exactly at 20 weeks. No, I think I did it at like 22 weeks. The growth, the anomaly scan, yes. So I did it at like 23 weeks. That is when I went back for a review.
Okay. Yeah. So you overspaced
I overspaced my things.
Now because you want
But I was also on supplements myself.
You're trying to defend yourself. Ni sawa. But we want people to do the right thing, right?
Yeah, exactly.
So how many clinic visits should an individual have minimum?
Ideally 4.
Ideally 4.
Yeah.
Maximum, or what WHO recommends, if you can?
I don't know, by the way.
8.
Oh, for real?
Yeah, 8.
So you go every month?
Ideally, yeah. So let me just show you how they're broken down. And remember, I took a photo. Don't get lost now. Yeah, so here. So between the first visit, the first trimester, between 8 and 12 weeks, the first one. So now there you'll have, of course, your antenatal profile where you have the tests, and then also to confirm that it's a viable pregnancy. So that's also where we get to see, is it an ectopic pregnancy? Is the pregnancy growing in the uterus where it's supposed to grow? And then also you do your first ultrasound.
Yeah.
Then the second trimester, between 24 weeks to 26. Anyway, it can start from 20 weeks up to 28, 26 weeks. You have 2 visits. That's the recommendation, but you can have 1. And there you'll do your anomaly scan. So the anomaly scan is just to check if the baby has any abnormalities in their anatomy. So maybe if they have a mass, or maybe if they have all their limbs, any abnormality, anatomical. Then now in the third trimester is when now they bulk all the rest.
Yes.
Yeah. So now in the third trimester, of course, we'll have another scan where we get to see that the baby is growing well.
Yeah, the growth.
Yeah. And then now for follow-up, because many a times people tend to go more to the doctor the bigger
Yeah, the
your
bigger you
bump
become.
gets.
Yeah.
But yeah, you should have at least 4. So at least 1 in your first trimester, at least 1 in your second trimester, at least 2 in your third trimester. But if you can go for all 8 of them, then well and good. Yeah, I forgot to mention.
That's a bad place.
That's what I was telling you. I wanted to hear how many so that we can see where you are. Yeah.
Wasn't so bad.
I forgot to mention also the ultrasound in your second trimester is also checking where the placenta is positioned.
Yeah, actually, that's the other thing. Yeah.
Because you can have placenta previa, accreta,
Yeah.
things that also they help us decide how your delivery is going to be and also how to manage you. Yeah. So huko pabaya sana. Yeah.
Nimejaribu.
Okay. So basically your clinic visits were nothing to write home about. Like everything was okay.
Everything was okay up until 28 weeks.
What happened?
When we needed to do the OGTT, not the glucose tolerance test. So I go, of course, with my requests, which I had gotten at 20, when I went for my 20-week scan. And I don't know, I was very nervous. I remember going for it and I was still very nervous because diabetes in pregnancy.
Big baby.
Yeah, and just a lot of things. Just a lot can happen.
Yeah.
So went for the test. So usually there's how they do it. There's first they take your blood before you've taken anything. So usually you've fasted the whole night.
Yeah.
They take your blood, they fast check before, and then they give you a result before they can give you the sugar solution to take. Yeah, so we need to know your baseline.
Yeah.
My baseline was not baselining.
Oh.
They tell me.
It was highlining.
Yeah. They tell me. That's actually. They tell me, by the way, we can't continue with this test. You need to go and see your doctor before we can continue. When I tell you, I went to my car and wept. I wept because I know what this means.
Yeah.
I cried so much.
Oh, no.
So much. And this is the time where I'm changing my gynecologist from Aga Khan to now Dr. Kenya, who was at Nairobi Hospital at the time. So we had been talking with Dr. Kenya, so we had said that I was going to start seeing her in the 3rd trimester.
Yeah.
So that, in preparation for delivery. So I had already told her my history, everything, sent her tests, everything seemed to be okay. So I called her, I actually texted her.
Yeah.
In the evening, she called me and she's like, why didn't you call me? We would have had a discussion about this. You should just call me and tell me what was happening. She actually video called me. Aki, Dr. Kenya, I love you so much.
Shout out to her.
So she video called me. Aki, she reassured me, calmed me down and told me everything is going to be fine. We will repeat the test.
Oh, wow.
You'll come and repeat it at Nairobi Hospital. We'll just do the test. Well, repeated the test and for sure, I did have gestational diabetes. And that was that. So 3rd trimester, shege. We started there. So we started with...
What? I'm just thinking about it. Like, you've gone so far.
Yeah.
And like, so week 28.
28.
Like, we're almost at the end.
When you're just about to finish, you start this madness.
Yeah.
Soon after that, so it wasn't so bad, but I had to be really strict on my diet.
Yeah.
So remember, I had food aversion, so I'm already not eating. I had started getting better with eating. And then suddenly, I have to withdraw the things I had started eating. Aki, I used to go to Java crepes. I used to be like, nilete hizo crepes kwanza. Nilete hizo crepes hapa. Ulete iced tea na passion juice hapa.
Sugar.
I want sugar. I want sugar. That's what I want. I could not believe that the one thing I could actually eat properly was now being taken away from me.
Yeah.
And that took a toll on me because I'm like, now, what am I supposed to eat? And second of all, diabetes in pregnancy. So I'm seeing people enjoying things like ice cream, things, whatever they'll enjoy.
Yeah. But
I can't. Upon adjustment, I'm starting to get the hang of it.
Yeah.
Was to mention something about cravings. At around when I was just getting into my 2nd trimester, I started eating nyama. Like a lot of meat. Like I wanted meat.
The whole first trimester, you were not eating nyama?
No, nothing. Absolutely nothing.
Ooh.
So I wanted nyama choma specifically.
Yeah.
And it's the time I called my dad ile tu out of, mnakula nini? I didn't even call. He posted it on our WhatsApp group. A photo of nyama. And I was like, oh my God, I'm going to come for this nyama tomorrow. Tell me why I call him the next day. That nyama ati is over. Aki, I cried. I cried and cried and cried because what do you mean? I don't even have the nyama, so I started eating nyama. He would ensure that every time I've gone to visit them, there's meat. Eventually, I stopped liking it as much as well. So sasa I've started eating more of wheaty kind of things, kidogo kidogo, because I still couldn't eat so. I wasn't eating so much because I didn't gain weight in pregnancy.
Oh, wow.
Mostly because I was not able to.
Oh, you
I was
were
not
eating much. Yeah, you weren't eating much.
Then another thing with problem with gestational diabetes for me was that I think I got some form of disordered eating because I'm afraid of eating, because if I eat, I might spike my sugars. I may end up having to need medication. Worries about a big baby. It was just a lot of things. So for me, I would eat, yes, but I don't know how to explain it. It became a problem.
Yeah.
So I'm not eating enough to support my baby and
exactly.
It's not enough to support her, because I remember by the time I was going to see Dr. Kenya for a couple of appointments later, she was like, you're not gaining weight. You need to gain weight. Like you're not, I'm seeing you're not eating. You're actually not eating.
Yeah.
So that was a problem. Kidogo kidogo, 34 weeks. I remember it was around my baby shower. And the day before my baby shower, I'd gone to the toilet. On wiping, I noticed pink. Just see pink.
Like, no.
At first, imagine what I think I was delusional or in denial. Not even delusional. I was in denial again. I see pink. I'm like, no, there's nothing. I go again. The second time, I don't see anything. I ignore it completely.
Yeah.
Scare baby shower, everything is okay. In the evening, I go to the toilet. I see pink again. I'm like, okay. At around 3 a.m., I text Dr. Kenya, Aki, you had so much patience with me, by the way. She will tell you I'm not a good patient. She will tell you. I was like, by the way, I have noticed when I go to the toilet, I'm seeing something pink. I'm noticing a pink discharge. In the morning, at like 9 a.m. in the morning, she called me. She's like, you saw pink and you didn't see that you should call?
You know, that's what I was... You're doing the thing that as medics we kind of complain about sometimes.
Yes.
When you've had
Sometimes
all the time. You've had the symptom the whole day.
Yeah.
And then now 3 a.m.
3
a.m. I'm not okay.
Yeah, because I texted and she was like, this is a serious thing. I need you to come to hospital, because it was a Sunday. She's like, I'm going to meet you in hospital.
Yeah.
First, I remember I need to see you. So I was like, oh, so I can come on Tuesday. She's like, Lynn, are you serious?
Hey.
Are you serious? You're
when the
hospital,
doctor becomes
right?
when they say doctors make the worst patients.
It's not a lie. She's like, you're going to come now. I'm like, okay, sawa. In that process, I ended up calling my sister. I'm like, oh, by the way, because I was to do a scan and then go and see her. So she asked, do I do a scan at Nairobi Hospital or do I do it at Aga Khan? I was like, let me do it at Aga Khan because my sister is there. And then I can bring the scan to you. Not a problem. So we'll meet at what time? 1 p.m. Sawa. I go to the toilet talking to my sister, but then I need to do a scan, this. As I'm in the toilet, nilisikia tu, pa. Nikki wipe, it's just blood. Imagine, just remember looking at it, because I remember feeling wet and I was like, apana, wiped, I just saw blood. And I told my sister, no, nadamu. What? No, nadamu. My sister, Yani, she was with my mom.
Yeah.
She was like, hospital now. Ended up getting admitted because now antepartum hemorrhage.
Exactly.
Now it's bleeding.
Now let's break it down. What is antepartum hemorrhage? Not that you want to use the big words.
Oh, sorry. What do I do? I don't know. Bleeding in pregnancy.
After
in the
28
most,
weeks?
after 28 weeks, yeah. So
to labor.
Yeah,
that's a period.
So horrible time. Had to be admitted. And during that admission, I don't think I've ever cried so much because you blame yourself a lot and you question a lot. Because honestly, the things that I had been so scared about, I need to mention that yes, did I have postpartum anxiety? Yes, but even prepartum, to be very honest, I did have anxieties, and it felt like everything I was anxious about was seemingly coming to fruition. So the diabetes, the bleeding, then usually, I didn't know these things, so I got the steroid shots.
Yeah.
That can sometimes reduce activity
Of the baby.
of the baby. My God, my baby was not moving. I think second day when I was in hospital, wasn't moving so much. And I remember we had to go and have a scan done at like 2, 3 a.m. in the morning. And just as we were about, we call it a biophysical profile. So activity is so important so that we can determine, are we going for an emergency CS or are we not? At the very last second, that's when he moved.
Where?
He
was just like, Annie
Where?
jokes. Sorry, I'm
Me
jokes.
I'm jokes. Me. Ended up getting, of course, after that, discharged.
Yeah.
And I was to stay home. This was around, I was 34, 35 weeks thereabout. So to stay home now. That week after discharge, stopped playing again, rushing back to hospital.
Yeah.
We get to hospital, we put the CTG. That that machine they put those things in, that we call it a CTG.
Yeah. And then you see waves.
Starts moving again.
Yeah.
I'm like, what is this? In fact, we started calling him dramatic boy, like DB, like you're a dramatic boy now. Like, what is this?
Yeah.
Eventually, came to now time for delivery. So this is third trimester. Please remember all these things that have happened. I wanted a CS. Let me be honest. I wanted a CS as a mode of delivery. And
can I ask why?
Yes, you can.
Okay, why?
My gut. I will simply say it was my gut, and I could not explain why. But for the life of me, I tried, hypnobirthing. You try to read books on trying to relax, because I was like, maybe I'm just nervous and I'm just scared that, I'm going to look like this, or maybe nitakuwa I'll tear. But my biggest worry was my baby coming out flat. So prolonged labor or obstructed labor.
Yeah.
And then I end up with a child who, yani birth asphyxia. It's a whole other thing.
Yeah.
I attend to kids, so I know it's a very, very heartbreaking journey.
Yeah.
And I did not want that to be my story. So for me at the time, thinking as a medic, yes, there was that, but also at the same time, my gut, I can't explain, I could not rest.
Yeah.
Anytime I'd think about vaginal delivery, I just could not rest.
Yeah.
Dr. Kenya, when I went to see her for the first time, she actually sent me a PDF on birth plan, and part of it was a CS. Like, if your birth plan is CS, it's okay. That's what you want, that's what you get. So after that, the scheduled CS was supposed to happen the day before I went to hospital. So the day before I was to actually go for the CS, the baby stops moving again.
Hey, drama.
So this is the third time I met Chakshiza, but I'm like, you've been dramatic.
Yeah.
You've been dramatic all this time.
He's like that.
He's just like that. So eventually we ended up going to hospital like around 4 p.m. heavy. Just go directly to labor ward.
Yeah.
Admission, Dr.
The
Kenya.
only straightforward part of a hospital is labor.
In fact, you don't show up anywhere. You just show up in the labor ward.
Beeline.
Evo too. And things are done so fast.
Yeah.
So I get there. They do a CTG. Seems okay. Actually, seems good.
Yeah.
Dr. Kenya is like, unajua ile kuenjoy. She's like, I'm not to induce you. I'm like, absolutely not. We're going for that CS. She's like, yeah, we'll just go for the CS. So there got to be an emergency at that time, so someone else went before me. Then finally I go. We are in theater, and first of all, the spinal ghetto. Oh my God.
Why actually, like, you didn't know?
No, but still.
Have you seen you've seen the size of that needle?
But ghetto. I remember I was pricked. I don't know, maybe it was how I was positioning myself. I don't know what it was, but I was pricked a couple of times.
Yeah.
It was to a point where I was sweating. Mpaka Dr. Kenya just, nikamwambia, please just tell him to just hold. Now the anesthesiologist,
Yeah.
just tell him to hold.
Pause.
Just
half
pause. I need
time.
to breathe. I just need to breathe kidogo. So she ended up holding me wakiwa na Dr. Rain. Oh, Dr. Rain. So that was my baby's pediatrician.
Yeah.
So wakanishikilia tu vizuri. I was able to get the spinal nini.
Yeah.
Nikalala. First of all, spinal anesthesia also ghetto for me. As in the things
How are you
I
feeling?
did not shaking, you know,
The
like
shivers.
the shivers
Yeah.
and nausea. I really wanted to vomit.
Yeah.
And I kept saying, I want to vomit, I want to vomit, I want to vomit, I want to vomit.
Now remember the patients in internship. That's what telling
Wait,
you,
daktari,
it's
yeah,
too
it's
cold.
too cold.
It's too cold.
And you're shaking
to
and
vomit.
it's kabisa.
Yeah.
It's a horrible experience.
Yeah.
So it was short-lived because I don't know, there's something
There's something they
sincerely,
give to balance it out.
sikumbuki hizo vitu I did
Yeah.
with babies. I'm sorry. So now, once they've, of course, now we've started the CS and everything is going, baby is removed. He did cry. Was it a strong cry? No. Because he had the cord around the neck 4 times. So like I told you, my gut, when I told you, I was not at peace because had I pushed, I'd have come out with a baby who's dead. 4 times around the neck.
It didn't show up in your scan?
No, it had never shown up.
Okay.
It showed, I used to be told you have a long cord. You have a long cord. The very, very last times, it was just one very loose loop around the neck. But it was always, it's a loose cord. It's a long, 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 long cord. And for sure, when she showed me, after we've removed the placenta, and showed me, it was very long. But it was around the neck 4 times.
Wow.
He ended up crying very well after they had left to go, you know,
resuscitation. And...
Yeah, fine. He was not resuscitated, but, you know, wiped down, whatever. But, like, being taken weight and all those things, they took
not resuscitation,
him... Yeah,
to the resuscitator, like to that
now
station.
That station.
Yeah.
So, and when they finally... Because they eventually... Because my husband was in theater with me as well.
Oh, wow. Is he a doctor?
No.
Oh, wow. I like that.
I told you, Dr. Kenya.
I like that.
Atakujulisha your rights. Atakujulisha what if you want your spouse to be there. Yeah. But usually there's a form you sign. Feel. Yeah. At least this is at Nairobi Hospital. There's a form you can sign. I don't know if it's still the protocol. So mtu asiende kusema ati
maybe you an isolated case.
I don't know, but there was a form that he signed.
Yeah. Okay.
So eventually he cried vizuri later.
Okay.
So now you can imagine all these things that have happened.
Yeah.
And then the fact that this baby came out with cord around the neck, that already solidified the anxious things that things that I was worried about. So in my head, I'm like, if I had pushed, this baby would have died. So it solidified my thoughts. They were not rational, but it solidified my anxious thoughts that this was about to happen. This was about to happen, which ended up making my postpartum journey very hard.
Okay. Let's pause there. Now we've talked for long and
Actually,
I want to find out if we can split this episode into 2 parts. So guys, this episode is going to be too long, so we've decided to just break it into 2 parts. So before we go, let me just allow you to introduce your space where people can find you, talk to you, Sema, and then we'll put it up at Chini.
Mindfence MD on Instagram. Actually, I am also on YouTube, but I have not been posting on YouTube. So let's just say Instagram.
Okay.
Mindfence MD.
Okay.
Yes.
And from what we've talked about, what's your take-home message for someone who's watching this particular part of the episode?
Follow your gut. Listen to your gut. To be very honest with you, there's a sixth sense. It cannot be explained by anybody or anything. Follow your sixth sense in anything and everything. If you question something or you feel it in your spirit that things are not the way that you want them to be, and you strongly feel you want to do something else, do that.
Okay. I think for me, just from your experience, is if you need to change your doctor, it's okay.
Yeah.
If you need to change your hospital, it's very fine. Go where you feel comfortable and go where you feel seen, heard, and listened to. And also go where your insurance and your financial capabilities match.
Yes.
Yeah. My name is Dr. Hope Simiu. Please follow, like, share on A Dose of Health on our socials, and leave a comment from what we've talked about. If this was your experience, if your experience was different, let's just engage in this conversation and see how we can make pregnancy journeys a bit easier, more talked about, and a bit more tolerable
Yeah.
for new mothers, young mothers,
Yeah.
a bit older mothers, just any mother in
Yeah.
general.
Yeah.
So that's it for today, and bye.
Bye-bye.